I think today's topic as possibly the most pertinent topic, starting from possibly the first year of medicine to the final year medicine, and later when you go for post graduation in any field. Most important question or whatever is asked is which book to follow, and there are hundreds of pros and cons for each of them, whether particular book or amalgamation of all books would be there. But the basic thing that would remain is whether we follow the Indian author books or the ones which are written by Indian authors, or the ones which are followed world over, the Western author books, which are also very much in vogue in almost all. And if you see the recommended books in most of the your universities or possibly even through the NMC, almost all subjects, the recommended books are still the foreign author books, and maybe a few Indian author books have come into that. So a very pertinent debate and a very pertinent topic that we are going to discuss. And Dr. Vijay and Dr. Navaneeth are going to take this debate forward. So let's begin by the opening remarks by Dr. Vijay Balaji.
Thank you, sir. So the first thing I remember when I joined MBBS was I just entered the hospital, and as usual, you're all confused what to do. So the first thing I went is over the senior was there. I asked him, "Sir, what book do I read?" So each one gives an opinion of their own. And then the professor comes to the class. I still remember these words by my professor. He saw us reading some book. He said, "There are only two outcomes when you should read a book when you're reading something. Either it should be clinically relevant to you, or it should be asked in the exam." So this is the primary focus of choosing a book. So whenever we are reading a book, it depends on what is being assessed. So like the adage goes, assessment drives learning. So what are we going to assess and what is being learned? So that will be the key point how we are choosing a book. So I think the most important thing as a doctor, as we all enter the medical school, is to see how we translate this knowledge to patient care. We always want that clinical touch from the beginning. So I think even the CBMA curriculum now has made it that when from the first year of MBBS, they have some amount of clinical posting, highlighting the importance of that as well. So the most important is having a very strong foundation, which is given in the first and the second year subjects. So the clinical relevance becomes that the foreign author books, what are the advantages of using a foreign author book? So one is most of the foreign authors, they are luminaries in their field. And there is extensive amount of research that the single person has done. The other thing is usually every foreign author book usually has multiple chapters, which is written by an expert in that particular field itself, in that subtopic. So that makes it even more relevant in bringing the entire experience. The third that is very relevant in the foreign author book is the rate at which it is updated. So very often there are very frequent updates that come in. And it goes through a very sophisticated peer review. So even for something to come inside a foreign author book, there is so much peer review that is being done before it comes. And there is so much of facts that are being checked before it comes into the before it comes to the market for anyone of us to consume. The other thing is the way most of the books are written. In choosing the book, it takes some time, but most of the time, the way the books are written is more of interactive. So there are few books from, let's say, I'll just quote some examples. Even from the most dry topic like biochemistry, which is just assumed that you just by heart some cycles and that is it with biochemistry. There is a book that is called Marx Basic Biochemistry, which takes the entire biochemistry into a clinical perspective. So every chapter starts with a case, and then the clinical correlation of, let's say, glycolysis or an substrate level phosphorylation when the cardiac myocyte goes into an ischemia. So you recognize the relevance of even the smallest of topics. That makes it more easy for you to understand at the bedside. And I think every one of us will agree that none of us would say we would have completed MBBS or it is fruitful if we would not have read one book, that is Robbins. So I think that forms the way the explanations are. it forms the basis of every single branch in medicine. So the foreign author books give us a very good foundation behind the entire for all the 4 years of medical education. Other major downside, I would say, for a foreign author book would be with respect to Indian data or Indian perspectives. So the epidemiology of some Indian diseases may be completely different from what is seen in the Western countries or whichever country the foreign author is from. So that is where some disadvantage of our foreign author textbook comes in. But by and large, with the concepts remaining the same for most of the diseases, I think the way to go forward to have a fruitful command over the subjects, as well as applying it to the clinical practice, foreign author book could be a better option when you're starting off. So,
Thank you, Vijay, for the opening comments on why the foreign author book be better compared to an Indian author book. Let's welcome Dr. Navaneeth for his opening remarks.
Thank you, sir. So, my topic, I'll open with the fact that, true to the tenets of actually the entire healthcare, we began years ago with just relieving the patient of pain. So it's basically improving the patient's care and patient symptoms. So to reach that goal, my argument is augmented on 3 main things. One is the rebuttal of what Vijay told was the over-expression of the conceptual nature of this entire field. Be it legal or medical sciences, we have more amount of information as facts, skills, or concepts. So these are 3 things that we end up learning. So skill is at bedside. We're going to learn eventually if you have a good mentor. You're going to have facts and concepts. Concepts start from when you start your first 3 year subjects. Probably is when you require these textbooks, or you might have a confusion between these textbooks and Indian textbooks. But as you scale up, throughout your MBBS curriculum, you go from first, second to third year, you see that these arguments actually steer away very suspiciously away from foreign authors. When you go to third year, when you go to fourth year, you don't even talk about foreign authors, be it Dhingra for ENT, or for Khurana for Ofthal, or for surgery, or Datta, or OP Guy. It's impossible for someone to come stand in front of anybody to go and say that OP Guy is not a authoritative figure in the field of modern pediatrics and Indian pediatrics, to be honest. So it's this conceptual information that is there in our medicine remains to a certain extent important. But after that, it's easy to actually understand the concepts and move. But to treat a patient, you need data. So whoever repeats the most, whoever practices the most, whoever is able to acquire that information the most is able to treat the patient better. So it is not just the concepts alone, but it is the representation and understanding of the facts also that is important. So who are giving these facts? If you look at the textbooks of foreign authors, I'm not generalizing it, but few of them actually end up having a narrative style of writing. When you go to when you actually critically see the textbooks they have more of a narrative style. So when you have this narrative style, it requires somebody with a free mind, clear thinking, and with already questions in place. So the reader has to have a question as to what am I going to do when a patient of pulmonary hypertension comes. So if he's already experienced in that field, if he goes to that textbook, he probably won't find answers. If you look at Harrison's, for example, it dives into etiopathogenesis a lot. He goes into etiopathogenesis a lot and then cut shortens the diagnosis and management. He's not talking about the complications of management. He's not talking about how to troubleshoot it. So that is probably when a person with an indigenous person who's understood the Indian society and who knows that complications and adherence of treatment is very poor in our country, who knows who actually writes up how to troubleshoot these symptoms. So that is where I feel that the barometer of calling foreign authors as a standard is completely wrong. It's okay to debate that Indian and foreign which is better, but calling Indian authors as a standard reference is totally not at all. I'm not okay with it, to be honest. And the third thing, what I'm basing it on, the final thing is, how many of us are actually well versed with the English that is written there? 3/4 of the entire Indian students, when they come out graduating from their +2 or matriculation, all of them are not studied English. They've come from a Kannada medium or a Hindi medium. For them to sit and understand that at that the pressurized environment, exams, society, and everything is going to be not so fruitful. Finally, at the end stage, when we go back and shut our laptops now, we are going to go back to Indian textbooks and read. We're all doing that in the four corners of our room, but nobody is telling it out loud. So I feel like calling it a standard reference is not good, but you can debate as to what is required and when. But certainly when you're treating something at the level of an undergraduate student, when you're treating something, or if you have questions after seeing a patient, probably I feel that foreign authors will not be able to give those answers correctly. And there's a lot of difficult language that is used in foreign authors, which are easily circumvented by someone who is studied, born and brought up in an Indian society to address those needs. So he is better capable of understanding that. And final thing is that why are we so acquainted with Harrison's or Robbins or Harper's? See, we also have a lot of stalwarts in Indian medicine. Like for example, I would say Bavaskar sir in Maharashtra is doing a lot of work on envenomation. But we don't, talk about him as much as we talk about somebody from the Western society. The inherent colonial mentality is that something, if I be able to hold Harrison's and go, it's probably more carries more vanity than actually carrying something else. That's definitely ingrained into the fabric of our system. So unless we remove that, we'll not be able to accept good Indian authors. And also the publication and the distribution, the entirety of our Harrison's and all those come from McGraw-Hill and Elsevier, which are all foreign-based companies. So they are able to drive much more muscle power and money power to publicize, distribute, and publish those materials. And that's why, and we are also hand in gloves with them. To call them standard references is going to be very unfair for medical educators in India and doctors who intend to actually educate for the younger generation of doctors to come forward. So I feel like concluding, I want to just say that books like that probably is hefty on the wallet and heavy on the arms. But actually, it's good to be on the bookshelf for some time, until and unless we are actually free with a free mind to go back and read it once you finished all your medical course. That's what I would say.
I think wonderful comments from both of Vijay and Navaneeth on the fact. I just want to take an anecdote from, I think, I would not name the author, very, very big author from infectious diseases. He did visit one of the South Indian hospitals, one of the premier South Indian hospitals. Then he went to a ward, and I think the postgraduate were bubbling there with knowing the author that such a big person is there and he has written chapters on ID. And then they wanted to take him to the ward, and then there was, I think, 15 cases of cholera or something, a particular ward there. The PG was overwhelmingly presenting him all the patterns and all those things. And finally, he asked, "Sir, your opinion on this, what is to be done?" And the author was very down to earth. He said, "I have not seen cholera in my life, and I have written like almost a monogram of infectious disease." So I think what basically governs is there are diseases which are endemic in certain places. There are diseases which are endemic, possibly there all over the world. So you have, especially the infectious diseases, when we see infectious disease, when we are looking at, it's quite varied. Okay, the non-communicable diseases possibly are there everywhere. So your basic sciences, the first year subjects, the second year subjects which are there, they are possibly all over the same. I don't think so, except for microbiology. And when microbiology, we also mean pharmacology of that also. So that has to be more centralized to a particular region. Then when it comes to clinical medicine or the clinical subjects, whichever the clinical subjects, it's totally different in different parts of the world. So the presentation of the diseases, how do you approach the disease and what are the treatment modalities available is totally different. Malaria proguanil is not available in India at all. Flu cytosine is not available in India, but there are recommendations. There are recommendations for the treatment of these. So these drugs are not actually available as such. So, and textbooks would mention. I still remember, I think 3 years back, there was an MCQ which came, I think, on EPG, saying the commonest cause for a rupture of splenic rupture, infectious cause of splenic rupture or something. And the answer was infectious mononucleosis, which I think in India is malaria. Isn't it? So the questions are directly picked up from the so-called standard textbooks. And for practical reasons, I don't know, it's been remaining the foreign author books. Harrison itself is a standard or Davidson is a standard of book there. So when we try to teach them that this is not the common disease and this is not, finally, when it comes to exam, as Vijay said, finally assessment is what drives it. And when we say an MCQ is given on some particular subject and some standard book has been given as a reference for that, possibly that would be the answer for that. So it's very important to understand the pros and cons. For the understanding of the disease, I believe both the foreign authors as well as Indian author books are wonderful. More sophisticated, the foreign authors, as Navaneeth told, the genetic factors, the pathophysiology is explained in detail. Possible. You can make up hundreds of MCQs just from one paragraph of Harrison. So that is more important. So for understanding, possibly when you're dwelling into possibly doing a post-graduation or maybe a subspecialty, there possibly you would require to read monograms of this. But when we are doing a basic undergraduate, I think we have to have most important the time frame that we have to finish all these subjects, which becomes a little difficult with foreign author books. That's my personal opinion. But yes, we do have a large number of foreign author books which are very, very lucid and very simple, illustrated. You have the Boyd's, you have anatomy, the Gray's. Nothing can beat the Gray's anatomy pictures. Nobody can beat that. The Boyd's pathology cannot be beat. There are certain things which are absolutely beautiful in that. So we will have to take a mix of both. Possibly as of now, we do not have a good amalgamation where you could get both of them. So we have to passively take it. If you take a subject like forensic medicine, tell me which forensic medicine book is there in foreign author. Tell me community medicine. It has to be an Indian author book. Park is the only book that is there, isn't it? You can't say that subjects. These are subjects which are, practically which are only here. So the same thing should apply for other subjects also. But yes, we have to, as I think is known that medicine can't be different in different places. Anatomy has to be the same. So whoever has written an Indian author book, possibly he is also based his findings on foreign author books. So the next point I would like to pose on to Vijay, Balaji is, now if you're saying that the foreign authors books, so how do we assess that this particular author or this particular group of authors are actually, like if you see Indian author books, it's very specific. There's one author who has written medicine, who has written surgery. But if you see foreign author books, there is a 6 or 7 of them, their names are there, and then many people are contributing. So how do we just go on to say that this particular book is genuinely it gives the right information just because it's a foreign author book, or do we have to look into more into that?
I think this is a very pertinent question because with the large amount of books that is being there. So what I found was my teachers who told this, because I think the teacher teaching you the subject has the best knowledge in that particular branch. He has read through all possible books, like the Indian author as well as the foreign author, whichever is very, the teacher always chooses something that is clinically relevant and it is easy for the student to understand as well. So that is one way. The other way, it is in a little harder way, is you will have to research about each author. Like let's say their special interests, not more so, it may not be very useful in the undergraduation point of view. More so, this applies more in the postgraduate point of view, where you are looking for more depth because everything boils down to patient care. So if someone has done special interest in a particular field, so there it becomes maybe relevant. So other way that we used to do was to look up, let's say for an example, where chapter in Harrison, where acute pancreatitis, let's say. So it is written by Dr. Vijay, who is an Indian doctor who has gone to the US. He is part of the Atlanta classification of pancreatitis, which is given. So maybe such things, although takes time, it is very rewarding in way that it becomes a concise of if a person is a part of a group that is defining the whole thing globally, so that becomes easier. But for an undergraduate, I feel following, having a good mentor who is going to choose what is really relevant for you and what is required. I wouldn't say like Dr. Navaneeth said. So like Archith sir said, it should be an amalgamation, because you cannot get everything in every book. That is impossible. And because the time is too less for an undergraduate, by the time you understand what is clinically relevant, because we are not seeing patients in, let's say, in the first 2 to 3 years, let's say. I mean, at least even whatever we are seeing may not really, it may not impact us much. It may not be the ground reality of what is actually being there. It is, we are just entering the steps. So just some amalgamation between both, I think, would be the first way to start forward. So a better way would be to just few illustrations are very good in foreign author books that we have personally found. But nowadays, even the Indian author books, they're coming up with very good illustrations because of the amount of students that are using it. So the best way would be you start off with any author book, because it is a personal choice. Some people like reading in points because, like, we are taught in our school and let's say in our 12th, like, we need points. These are the keywords, these are the key points that you remember, and this is what is required in exam. So somehow mentally we are trained to take everything in bits and pieces, like in points. So some books really offer it that way. So some people find it very easy to take it. Some people like a very narrative style. They like stories. They imagine a lot. So it is a personal choice between an individual choice what they're reading. So that, I think, would be a way to assess.
That's for the foreign authors, where you have possibly a few books there, not to the level of what we are having in the Indian author books. So Navaneeth, when we say the Indian author books that are there, we have a wide range of author books, possibly in the north, in the northeast, the south. You have different author books for a same particular topic. And practically, we know medicine, the subject is the same, the topic is the same, the investigations are going to remain the same, the treatment is going to remain the same. So that dilemma of having multiple Indian authors, how do we go about it?
I feel like, sir, I'm too early to judge people who are writing textbooks. But what I feel like, if you have to self-analyze it, I feel like the best parameter is to choose something or someone who is not steering away from facts. He's able to represent concepts, facts, and probably skills all at the same time, who's not compromising just one for the other. Because somebody who's able to deliver a lot of concepts might appear to be very attractive, but it is not going to be fruitful. He's not going to tell me what are the facts are. So someone who's able to tell the facts as brilliantly as concepts is someone to be chosen, according to me.
So I think the point here, when we choose a particular book, many things go. But please remember, I think for undergraduates, when you say, basically its book is just going to be and you can read the book anytime, but finally it has to be correlated with your patients. And more importantly, you have to understand it with your teachers. So teachers make it. And there are many things which you would read 100 times and you would not understand, as the teacher telling you once, everything would come clear. So books are going to be there, books for, at least for the theory part of it, the books are the major chunk, but understanding of it is basically by possibly a teacher or a mentor. And generally they would generally recommend, good teachers would generally recommend possibly the best books that would be there. They would have seen a lot of it. And for postgraduates, or maybe when you go higher, possibly you will have to look into the credentials. As both Vijay and Navaneeth said, we will have to look for how the approach is. Is it only based on something else, or there is something unique in each of the authors? So that
and something that is upcoming also, sir, I would like to add is the people, Indian authors specifically, the ones that are coming out now, sir, are the ones who are taking classes online also, which is becoming a bigger platform. And they themselves have written books that becomes very synchronous to learn through them.
Yeah, that's one point. That's one point regarding the Western authors. Most of the Western authors are possibly involved in research. Quite a lot of them are hardcore research ones. They're definitely great. But then when it comes to practically teaching, or the clinical exposure of them is much lesser compared to possibly any of the Indian authors for that matter. They're all practically who are there. So that's the first point. How do you choose a book? Now that's when we talked about the theory part of it. Now when we know that the exam is in a particular pattern, the exam pattern, we know it's a long question, it's a short answer question, maybe a case related question, maybe MCQs. Does that have a bearing on the books that we purchase? Vijay and Navaneeth, I think we'll go with Vijay first.
Yeah, so I think finally everyone wants, because of the volume of what is there in MBBS. So everyone, the first question is, will I pass by reading this book? I think we all start off that way. So definitely it has a bearing, because not everyone can, like Dr. Navaneeth said, not everyone can sail through the books at the same level of ease, because each one's level of understanding, there are multiple factors that come into how information is taken by a student. So only a few things that I would say it is for both, foreign authors as well as Indian authors. So at least in the initial stages, let's say first year or second year subjects, and to some extent in the final year subjects, just the illustrations. So I think that helps in with respect to foreign authors that I've seen, more colorful illustrations that help to retain stuff, because most of the time, most of our exams rely on just rote memory, and very little of concepts are really actually tested. And I think now the CBME curriculum, I think, has gone into adding OSCE and OSPE, that is trying to bridge the large gap that is there, of making it completely theoretical and very dry. So that is one thing that with respect to the authors that is there. The other thing is last minute how to maybe how to remember or something. So I think only with flowcharts, I think that is the only way I think we can basically get through all of our exam. It is just algorithms. Without that, I don't think at any level, either UG level or PG level or at any level, I think finally condensing that information into some flowchart or making a flowchart of your own by amalgamating multiple books. In the early stage, I think that is the only way to go forward, at least for the exams.
I think the advantage that the Indian authors have,
that is one
theory exam.
Absolutely.
What
exam oriented.
Definitely advantages that Indian author books when it comes to theory exam. What's your take on it, Navaneeth?
So I feel it is the system that has to change first. So if we are going to a pattern like Dr. Vijay said, if we're going to next wherein there's going to be subjective and not just narrative, as even we are writing long essays from UGs up till DM. So that is going to change the way we are going to study. That is one thing. And the big irony is that the people who in US and UK, they themselves, the students themselves, don't read these books, because they are handed out, given handouts, they're given PPTs, and they are studying from that. And their assessment is more objective, whereas our assessment is more subjective. But we follow their textbooks and they don't follow their own textbooks. That's the irony that I want to bring forth. So it's going to change only the system of assessment changes.
Yeah, basically, as of now, I think both undergraduate or even the postgraduate assessment still remains the very dogmatic, long, short questions, etc. So possibly in such cases, I think both books are okay. But I will just give an example. Possibly, I think atrial fibrillation was asked for a long question. And then if you see the standard reference book of medicine, I won't name it, doesn't have even 4 causes of atrial fibrillation, and cause of atrial fibrillation had 4 marks in the theory. So how do we give it? Obviously, the candidate, if there are 4 causes in the book, would not even remember 3 of the causes. If there are 7 or 8 causes, maybe they would remember a little more practical part of it. I'm saying the point is what is there in the book. I'm saying when you set a question paper, the answer key is set without a textbook. You know, the answer key is set verbatim, the person who sets it possibly. And the one who corrects it goes on his practical approach. It is not mentioned in any book. So that's what. But when it comes to MCQs, I think for all practical purposes, there are standard books which are mentioned. And fortunately or unfortunately, the foreign author books still remain as a standard for MCQs, which I think will eventually will change, because it's not going to be different in an Indian book. If a particular cause or a particular treatment is asked for a particular disease, it's going to remain in the same, but still the answer keys are in the foreign author. So I think, again, when we say if a person presently, when we MBBS students joins the first year, sometimes they are clear what they want to do. They want to remain in India, or they want to go abroad, or they want to pursue something. Does that have an impact on the book that they have to choose? Vijay?
Yes, sir. I think definitely that has an impact, because what is being tested is different in different exams. So I think USMLE or a PLAB exam test some parts which is more compared to an Indian exam, which doesn't really focus on some particular parts. So I think based on the exam, I think we choose the books. The other thing is the crossover that happens. So initially, let's say someone wants to do a USMLE or something. When problem is the later parts of matching and all, there are so many uncertainties as well. So later when he falls back on that, that is when there is an issue with how he can crack the exam, because there is so much volume that he cannot read through all of the books. So I think if the person is very sure that he wants to leave India or he wants to practice medicine in some other part of the world, then I think at least for the basic sciences, at least the foreign author books will have a bearing on, because your initial passing of the step 1 exam or a PLAB exam depends on the basic sciences largely, by and large, at least initially. I think the clinical part remains almost the same, because almost most of it is guidelines that are there. And most of the books, both the Indian author and foreign author, pretty much condense the guideline in all of the books. So I think at least the first year or the second year sciences have a large bearing on the exam that is being chosen.
Take on that?
Sir, mostly what I've seen is if they would have made a decision of leaving to the US or probably staying back in India, that decision probably would have consolidated by the first 2 years. So that whatever they learned in the first 2 years, I feel like we should still stand our ground, because there are still ample amount of resources that they can use which are indigenous to their USMLE preparation, like UWorld or the books that they refer. And mostly it's already online. So it's not that they have to go there and learn. So if they are having their resources, I think we should be able to stick to our resources and improve that. Today we are having this debate is because of which the reason why we are having this debate is why Indian authors and indigenous publications are increasing. So that's why we're having this debate. This debate would have not happened if it was 50 years old ago. So I feel like we should still stand our ground, improve the first 2 years of the syllabi as well from indigenous authors, so that they can, if they choose to go to US, they can choose their own resources. So I think it does not matter how your decision is swaying to, because anyway, in the first 2 years, it's going to be very similar.
Conclusion of that point, possibly as far as the basics, that is the basic pre-clinical subjects, the concepts are to be learned, both maybe Indian author book or a foreign author book. The concepts have to be same for both. When it comes to clinical approach, maybe you'll have to take a mix of both, whatever. Now, what is coming up of late, possibly, be it an Indian author or a foreign author, the guides and all those things, with this, so much of online classes that is coming, there is, along with the online classes, there is so much of notes that is given, so which is neither authored, isn't it? It's not an Indian author or a foreigner. Definitely, it's an Indian author who's given it. So because these online notes which are there, where they fill off 30% of the page, and then there is 30% the student possibly has to see the class and enter, something like that. Notes is available in all the almost all the online platforms, whichever is providing the. What is your take on that, Vijay and Navneeth? We'll go with Navneeth first for that.
So I think in debates, in questions like this, it's better to understand what fundamental principle that we are sticking to is the ability to treat somebody without causing problems. And if we steer away from lucrativeness, if we steer away from our own benefits, we need to improve Indian medical education on the whole. If we are able to do that using proper legal means, I feel like it's definitely a go for. I am not against online learning or online platform of teaching, because what happens is we need to see what we are doing in the undergraduate curriculum. If we go back to undergraduate curriculum, if that particular professor, let us say with all respect, has not understood a particular concept, it's highly unlikely that he's going to go back and understand it and come and deliver it. He's not going to do that. He's going to tell and spend a lot of time on the things that he has understood and try to engage the class instead of actually teaching the class. So in that kind of a scenario, a student's time is actually extremely valuable in the time when he's actually learning in MBBS. So if he's able to put the same amount of effort in understanding from an online lecture from a credible source, then that would be all the more beneficial than actually wasting his time in a lecture without any check or balance. So I feel like it's a go for.
Yes, Vijay, your take on it?
Yes, I agree with the same.
Yeah.
Because I think,
as well as the notes, I'm talking about both Western or Indian online.
yes, sir. I don't think we get much of foreign author. There is particularly no particular notes that is available, although there are some coaching institutes. By and large, it is even there. It is not a single person who is delivering. One person who is trying to understand the whole system of what is being relevant and being delivering it to us. Similar in our Indian medical education as well. And all of us would have gone through that because it saves time. So I think it is a go through. But one thing is it should not completely replace the entire learning, because it becomes a shortcut and the learning becomes very superficial. Little more something is tested, you cannot really stand much. So I think maybe the better approach would be just to go through a lecture quickly and take a notes that it helps your exam or something, condense it. But definitely you can, that will be like a small something to understand the concept quickly, and then you dive into something, because that makes it more wholesome. So you can save time as well as you understand the depth as well. So I think both is clinically very relevant, because of late, like the using of textbooks as like both either Indian author or foreign author is completely slowly taking a backseat, and it is wherever it is like only notes, that is like, it is like almost like note is sufficient. So I think that mentality as well has to change as well, because it harms the not only the student or the doctor, but finally the patient takes the brunt over it. I think that is a little relevant in the current scenario.
It's like coaching for any other subject, possibly the same thing, where it is some sort of a shortcut which has to be taken with its limitations. Now, with the onset of the CBME curriculum, which has come, where possibly I think before CBME, that's 4 years back, where a given undergraduate would have to learn around 2,500 diseases, this full curriculum. The new CBME, we have 180 diseases which has to be learned. Now, that's the truth that has come with the so-called Indian medical graduate. There are diseases which were there in possibly all the systems which were there. 1/10 of the diseases have come into curriculum. The curriculum is present in open, everybody can see it, the undergraduate can see it. And as per the recommendation, the questions have to come from that curriculum itself. Now, in that context, almost possibly all the Indian author textbooks, I think, have modified it, have incorporated it or highlighted the so-called CBME related questions. What do you think is the take on that? In a CBME curriculum, whether the Indian author books stand a little more, or possibly, because Western author, obviously, none of the Western author books have incorporated the CBME curriculum. Let me go to Navaneeth first and then possibly to check.
So essentially, sir, I think if we have to answer to that, we need to analyze what is happening and when someone gives an exam. So if we actually interview about 100 students who have just finished an exam in UG, you ask him, he will be able to deliver only a certain amount of diseases that he considers to be important. And essentially that's what has happened as to boiling down the diseases as to how much is more important. Now, the correctness is up till here. I feel after this, if we start segregating and saying, okay, this is most commonly asked, only concentrate on that, and that becomes a harm. So concentrating on the diseases that we can actually learn and work upon would be a good choice, because essentially we would not go. For example, if you ask a UG student about some random autoinflammatory disorder, he would probably not know it, and we cannot penalize him for not knowing it, because eventually if he goes into medicine and further on, he will have to learn it. But an undergraduate level, I don't think that is necessary for him to know that instead of TB or HIV, which becomes more important. So having that algorithm in mind, I think it's good that the segregation of information to be acquired has been set up.
That's what the Indian author books have maybe possibly moved a little forward there and have captured that more importantly. Possibly that is not yet happened with any of the foreign author books, whatever the books we have mentioned, especially the clinical as well as the pre-paraclinical also. I think that is not happening. Vijay, your take on it?
Sir, I think the foreign author book, I don't think is it is not written for particular Indian student. They are writing it for how their country works, or predominantly how it works. So we are just we take it because it is it gives a better, we feel that it is giving a better understanding. But because the way the exam tests, so finally I think if you are speaking at the level of an undergraduate level, so finally it is how we are being assessed. I think it boils down to that. So we'll have to take whatever is relevant in whatever. I think the Indian author books are going or being written in accordance to what is being relevantly according change the syllabus. So there I think the foreign author books may not really stand complete chance, but I think the illustrations as well, I think that can just hold on at least at the level of maybe the initial subjects. I think paraclinical and preclinical subjects, I think it helps. Clinical, I think, and one thing I feel the semi curriculum is what was being taught before, like maybe stressed significantly, let's say common diseases like valvular heart disease or something that commonly undergraduate is tested, and it is common in our practice as well, because like any OP you sit in a hospital, like you are bound to get at least some significant amount of a valvular disease or rheumatic heart disease. That is our epidemiology. So somewhere some parts of the curriculum I think also have to be revised based on what is very clinically relevant in our country as well. So I think revisions will keep happening. It is evolving process, a continuous evolving process.
So that's what the foreign author books are not specific for India, subcontinent, etc. There are other cases. Do you see a lot of foreign author books coming with a South Asian edition, or maybe a Indian edition of that, possibly to include all those sections which are possibly more epidemiologically relevant? This is not so relevant for undergraduates, but when you see a postgraduate book, your neurology book is there, there is a South Asian edition of that, maybe where they discuss all these tropical diseases and etc., which possibly is not there in the main. And as you said that these books are supposedly meant for the rest of the world, but we do know that the rest of the world still would read the Indian author books. The Indian author books are much more rampant in Germany and all those places rather than these books that is there. So I think that's the part of the theory. Basically, the books, the basic concepts which have to be learned. It has to be there in both of the books. When it comes to practicalities, I think each book has its advantage, and it, if you say the pathophysiology, etc., once it is learned in pathology, I don't think so it is needed to be again re-emphasized in a medical book possibly. Now, I think coming on to the most relevant point that is important between the Indian author and the foreign author book, let's come on to the clinical part. So, be it clinical medicine, surgery, OG, or pediatrics or orthopedics. Now, what is the importance of an Indian author book when it comes to the total practical aspect? Because that's where theory, I think everybody would pass on. The practical aspects where you have the so-called examiner-centered exams, not the student-centered exams, the examiner-centered exams, where questions are asked, the answers are, a standard answer should be given and all those things. In such a scenario, which is all over India and maybe some other parts of the world also, where the OSCE has not picked up that much, in such a context, whether the Indian author books or the foreign author books would score there. Let's start with Vijay.
Yes. So I think we'll stick to, I think by and large, we are sticking to the undergraduate curriculum. With CBME curriculum being implemented with OSCE that is coming up, I think that is maybe before the entire implementation of the entire curriculum. Maybe I would say it is completely Indian centric, because you have to name the causes like you had told. Like if you ask the cause of most common cause of ruptured spleen, if a student answers more infectious mononucleosis, like outright he'll just be completely failed. Just close the eyes and fail, because it is not the epidemiology of our country. So I think this is where, and since our MBBS also we are taught in examiner-centered approach. But there is a downside to as well, wherein it becomes too much of facts, and in the era of evidence-based medicine, because there is so much of clinical that can go on. We can keep examining and we can find so much, but how much useful is it clinically in a patient-centered approach? So that is when now the things are, even the physical examination or any of those points are becoming evidence-based. So I think adapting that will make it more wholesome for the learning as well. And becoming an OSCE pattern. So it is like an amalgamation of best of both worlds. I think the pattern is like you have an Indian examiner asking, as well as the pattern is somewhere bridging what is the best of whatever evidence is there, and some things that are really ignored, which should not be, which we don't realize at the level of an MBBS level. Let's say communication skills, or let's say when we are doing procedures. So it is taken for granted. Okay, you just lift the shirt up, or just without explaining much, we take some things for granted. So I think that structure is a welcome change in the curriculum that is there. So I think again it is a bridging of both. I think because both authors help, but more so I think at the level of an MD level, I think the Indian authors always are hold a better option, just for the reason that you can because most of it is again rote testing. So you will have to name causes very quickly because time is a shortage there. So you don't have the feasibility of time there. No matter how much you know, even if your concepts are good, you should be able to bring it out in such a way that the examiner understands that you know. So finally, everything boils down to whether examiner understands whether you know or not, rather than your knowledge. Although it is a sad part of the education, but maybe we'll have to find some way to have a testing of best of both worlds. I think that would be my take on this.
Completely easy for Navaneeth, because I think Vijay tilted to your side when it came to clinical part. I think Navaneeth, your take on the clinical books and the point whether it's a foreign or Indian author.
So when it comes to clinical examination, I think practically what makes a lot of difference is who's teaching you. So in the exam, it's not just basis of reading, but it is skill. So if your professor or if your senior resident has taught you well, you'll be able to demonstrate those clinical findings by attending bedside testing. So that is completely disjunct with having to read a particular clinical medicine book. But even if you have to read, I feel like by that time, I think note-taking would be definitely a big solution to this. So note-taking lets you prepare your own textbook of yours, which has everything. So anyway, if somebody is writing on something anywhere, it's extremely rare to find somebody who has not written one word about what's happening bedside or what's happening at his home. So by creating a succinct place where he has written all the points would solve the problem. I don't think we should have a discussion of whether clinical medicine books, Indian versus foreign, because I think at the end we have an ample amount of clinical data. It's totally subjective. So I feel like we can make notes, and that would be a very big solution to these problems.
It's a very relevant point. When it comes to clinical medicine, it's not theory. It's practical. It has to be practiced. It has to be learned at the bedside. The more you do, the better you become. Correct. The causes would possibly be there in any book. You can mug it up and you can comment. But when you have to find the clinical sign, it has to be bedside. And when it's bedside, it is always see and learn. You see somebody do it, practice it again and learn it. So that cannot be done by any textbook or any video recording or anything. It has to be done practically. So clinical medicine definitely is more of bedside. And how do you do it? Yes, you would have to interpret it in the context where theory would, the knowledge would need it. More importantly, if you see practically on my personal experience, I would have to say about the foreign author clinical books have tilted a little more towards the investigation part of it rather than the basic clinical. As I think Vijay told, always the sensitivity and specificity of each of these clinical tests, possibly if you say the percussion methods of spleen, there are so many methods which have been described and their sensitivities is much low when compared to possibly an ultrasound. So possibly there, when you say you have a good textbook on differential diagnosis where they would give the sensitivity and specificity of each of these values. But something like taking a blood pressure or checking the pulse, I think that can be universally 100% informative. Okay? So it depends upon the particular clinical science. How much should we go and palpate and try to get something rather than just go on investigation. So the foreign author clinical textbooks have moved away from the clinical methods. Possibly there are many medicine books which you don't even tell the breath sounds now, or the crepitations, what is course, what is, it's totally changed now from that. But still the problem is the examiners have not changed. So possibly still would remain to know the older parts of it. So you have to use, because majority of the Indian author clinical books do not dwell that much into the investigation, which is also important. Once you make the diagnosis, you have to confirm the patients, you would require those investigations. And definitely it's a point that is in favor of a foreign author where you have the newer investigations which are definitely mentioned there. So, but the baseline point, as I would say, I think both of the speakers were already told it, it is clinical. It has to be learned by your peers, by your seniors, by your teachers, and it has to be practiced and mastered. So I think we have discussed both the theory part of it and the clinical part of it. And once you've finished it, possibly when you're going to your super specialization and when you're appearing for the super specialization entrances, Now, which of the books, if you possibly would have read, you would have a little advantage compared to the other. Let's begin with Navaneeth for this.
So actually, what I feel is once you're going to super specialty exams, it becomes completely competitive. So it's extremely objective. So in that case, it requires for what exam you are going to appear. If you are that, it totally depends. There's an whole ball game that opens up, and the exam that you are going to appear for will have certain subjects or certain textbooks in mind that you need to read to, and you have to go for that. And as we go on, I wouldn't say super specializing, I would say subspecializing. When you say subspecializing and going on, I feel like the information or the data that you're going to take is primarily coming from ongoing research and online, basically, which has a higher turnover of information and change of information. So it requires a lot of unlearning and learning that has to take place at a constant rate. So I feel like sticking to a book would definitely be extremely detrimental, although you can base it on it, get your concepts right, and you need to make, I'm a pro note taker, so I would always say take your own notes, make your own changes with each information that is given to you, and a higher relevance on online and journals and articles that would take a higher impact than going back to books and standard reference books. So both of it, but definitely a lot of unlearning has to take place also.
There's a very one concept I think Navaneeth has been taking on from long time, saying writing notes. Notes. That's what when you learn, maybe you hear many speakers, you hear many teachers different on the same topic. Possibly you would write down all those things. And I'm very sure quite a lot of Indian author books have come up in that way, based on their notes and experiences which they're playing. And that's how books come up. So eventually each of us would have a book of our own. Yes, Balaji, your take on super specialty, and if at all you're prepared with possibly a Harrison, are you better than you would have prepared with the Indian author?
The answer would be yes, because the exam is just, so most of the people who are sitting, so we are looking at from just an exam perspective, and not basing it on completely on complete patient oriented care. So if coming to the exams, most exams require you to just read the important topics from the standard textbook which is set for the exam. So, and most of it is just not much of an effort. They're just picking up directly lines from the standard textbook. So I think a person who has read, and you don't have to read the complete textbook completely, just what is commonly tested, what is commonly relevant. I think 80% of the exam is just going to be from that, and in a little more depth. So I think sticking to the standard textbook, even for the NEET or SSD, INA or whichever exam, I think it makes it easier. So just highlighting, so like either making notes or highlighting it. So I think that would help in easily clearing the exam. But what happens after clearing the exam, I think is completely, I think at the level of maybe an MD or a DM. Subspecialization, it is mostly into research and articles, because textbook can lead you only to some extent, because again, what comes in textbook is what the journal has given 3 years back or 4 years back. So I think staying up with the latest research is what we are heading towards, at least at the level of MD or a DM. But at least to get to that or get onto that step, I think just sticking to the standard textbook, which is commonly tested topic, I think is easier for getting.
You said that there are standard things. It has to be the same cause in all the books. Supposedly the commonest cause is given, or a calculation of something has to be done, the formula would be the same. But yes, as the questions which are set are taken from one standard book, usually the standard book is a foreign author book. So I think that little advantage is there. We say when the NEET paper comes out and then we analyze the paper, we would find that there are, at least I think in the last 3 NEET papers, I've seen more than 140 questions were there in my book. But then they were not verbatim. They were not verbatim as the verbatim which would be there in the particular book. So any book you read, if you have read it in the proper way, you have made the concepts clear and understood, I think that should not cause a deterrent for you that you have to read something else more, or just by not reading a book, you have a little disadvantage when you come for your super specialty, which is as of now multiple choice questions based. eventually, possibly when the case-oriented things would come, the image-oriented questions which are coming now, the ECGs, the clinical images, the skin changes, etc. I think there it's all going to be your experience of what you're seeing. You would not identify a clubbing by the textbook. You would see it really in. So that's where it importantly comes. When the clinical case scenarios would come, no textbook is going to give you that. You can just learn the basic concept from that. No textbook ever is going to say that this clinical scenario, this is the diagnosis. It has to come from your understanding of the subject. And that's where we are eventually going to move towards. And I think that would be the best thing to happen to any of the exit exams possible. So I think we have discussed in this last around an hour, I think we discussed about the theory, the practical part of it, which is good, which is better. So I think both Vijay and Navaneeth have given their very, very, very good insights regarding pros and cons of each of them. And we have agreed on certain things. We have differed on certain things. But certain basic things that we have understood is that it has to be individualized. It has to be from our peers. And clinical has to be practiced. I think we would, if there are any questions or comments, otherwise I think I'll take the closing comments from both of them.
I think one question is from Hardik sir. What is your take on clinical books? For example, right now in medicine, we are being told to read Hutchinson, while I'm using the author's. We discussed that matter. That's what. Each has its own advantages and disadvantages. That's fine. Okay, I think there are. So just one. I just wanted to put this. It is just a food for thought. There is too much that is focused on a particular sign or a demonstration. I think clinical is completely bedside, and there are variations of each one how they have learned. I think that also there is some amount of differences, and that becomes an issue in the exam as well. Like one examiner fits 6 to 1, and so you get into trouble. But by and large, mostly it is fair. But whereas I think just out of this one that we are going into more objective, like how much we can understand. So the amount we would have heard through our stethoscope of a cardiac or respiratory sound is going to be definitely less compared to how you would have been trained and how our teachers would have been trained, because the exposure is completely different. So that is one limitation of our clinical medicine, I feel, at this point of time. And now for the same amount of funding, there are easier investigation that gives you much more information than a simple your examination can be. So maybe our education system can also inculcate something, maybe in internship wise, like extending of an ultrasound or something that adds so much of more clinical information with the same span of time, rather than very rigid testing of very core facts that may not have very good clinical implication. So maybe that is one thing that just wanted to put forth.
At least we're in a good trajectory. At least practicing on mannequins. I think
at least we have started that.
That started now. That's very much started in undergraduate.
It started, but I don't know how far it's going to go.
Yeah,
because they can't be doing it.
To a lumbar puncture. I'm not saying about. We are in the medical. We are all three in the medical part of it. Does a surgeon or a surgery postgraduate get his degree by seeing his surgical skills?
No.
Or an orthopedician gets certified by doing his surgical skill, or a OGPG sees the delivery and how the delivery is done. That's a sad part of it. We in medicine and pediatrics, possibly we can still make clinical diagnosis auscultate. The surgical part is not assessed at the postgraduate level, be it super specialty level also. When they assess in their exams, it's purely theoretical things, isn't it? So we have moved a really big chunk in when we see about undergraduate. When our postgraduate curriculums, especially in surgical fields, have remained there. In undergraduate, I think we have moved a real big way by introducing this skills that is there. And if the skills have to be demonstrated in the finals, I know it's a set where I think medicine has only 8 skills, so it's very easy to clear it out. But I think it's not going to remain like that. There are examiners who are going to sit and scratch. So that is always going to, but then that is what is going to make the student better. It's not just, as you say, auscultating a murmur does not make a big thing. Finally, we have to do echocardiography and confirm it. So we can't, how much ever dogmatic, and I stand in one leg and say this is a mid-diastolic murmur, tomorrow it will become something else. I can't stand on that. So I think that change is going to be there. Investigations have their role, and investigations have to be emphasized in undergraduate level itself, and it has to go hand in hand. That's a very well taken point. I think a final comment by Navneet and Vijay before we wind up. Navneet, your take on the entire.
Sir, I think we're going towards a positive graph. I think Indian medical education is coming up in a big way. Definitely nothing to worry about. I think we have a lot of authors such as yourself who are doing great work by bringing out such good literature. I don't find anything else to say because I'm really happy that Indian medical education, we're having this debate, which was due years ago. So I feel good all in well, and I really thank Kishan sir and yourself to invite me for this debate. Thank you.
Yeah. So I think finally we all want our education to be very fruitful. I think that is where all of us are headed towards. I think so. If we compare our undergraduation days to how our the resources we had, particularly medicine, we had pretty much nothing. At least when we were at least doing our MBBS, there is nothing very structured. It is just like haywire, and so I think I think your books have actually revolutionized at least the learning of medicine per se for the undergraduation as well as the post graduation. I think like Navneet said, I think it is a very positive outcome of our education, and we are training as well. Like it is going towards a positive change. Only thing is, I think one thing that I felt maybe is all of our teachers have immense clinical exposure, and some things just because the foreign author tells or someone says, it is taken as a hitherto. So even though we have a clinical experience, we are not bringing out, we are not conducting it in a systematic way. So I think even for the simple furosemide challenge test, I think it is from ages we know that if patient has AK, give a diuretic, see if the patient improves, the AK will improve. I think we have been doing it for years together. I think maybe we are not implementing it in a structured way. So that is why maybe some amount of feeling that maybe foreign author is better or something that creeps in. So maybe if all of, because I think every of our professors have so much of clinical depth. I mean, because we know the way how they are treating patients. So I think there is so much that we can learn from them. So maybe if all of them come together or make it in a structured way of whatever is there. So I think we will be changing huge, like the entire system of whatever is saying the standard of care or something. I think it will largely change because we will have our own way of treating patients, because finally it is going to be our Indian epidemiology that we have to treat patients on and not completely base it on the Western data or completely like that. I think maybe that is one thing that we can go towards. So I think that is one thing, because we are seeing it more and more. More clinical we see, more we realize that even though our professors have so much acumen and there is so much that is there, but somehow it is not brought out. Not many people know it. It is just hidden inside somewhere. So that is one thing, sir.
Would be concluded in all these things possibly. Something which off note, possibly the number of colleges coming up and number of the lack of clinical material that is available in quite a few colleges that would have a bearing on the learning process of clinical. So that one thing is always going to be there. However good the clinical book or whatever you read, you have wonderful teachers, but then you do not have chances to practice it, nor you auscultate a murmur, nor you maybe hear something or palpate something. It's not going to be a so in that way, maybe these managements and all things may help it. That's one disadvantage which we're seeing with the number of newer and newer colleges that is coming. That one problem has to be sorted in possibly in a way. Otherwise, the way the system is going definitely is in a very, very positive way. We are emphasizing on the must-knows, possibly the main things that is there, and communication has been coming up in a big way. You have the outcome modules which have been added. Possibly all those things we are just competing. We are coming closer to possibly what is in the Western standards. Only thing is the investigation part, maybe we are not that concentrating on, which I think we should also add on to teach them, to ask them to interpret, and possibly to practice later also. So I think in conclusion, as we all said, the basic concepts have to be basic, has to be learned from any of the sources possible. Be it Indian, be it foreign authors, whatever you will be able to understand in a better way. Possibly there are flow charts, there are colorful diagrams, there are more neat diagrams, and maybe a pictorial representation which help you. So whichever book could give you and help you in building up the concept, you will have to take. But when it comes to the later part, it has to be a clinical correlation, which has to be based on the epidemiology, the commonness, the availability of something. And as you go higher and higher, textbooks are just going to be a very, very small part, have to be updated with possibly the latest that is happening. Things are changing, the drugs are changing, the diagnostic is changing, the disease patterns are changing. So we can't just keep back with what is written in the textbook and then remain there. As you become more and more senior, maybe when you become a postgraduate onwards, it has to be more of articles, more of review articles, more of possibly something like an up-to-date or something where things keep occurring, which are definitely more peer-reviewed rather than any textbooks. So I think we've had a wonderful and fruitful discussion.